artificial disc replacement. Walk us through it. And
disc replacement is a amazing surgery for the right patient. And I think it's just because if you think of the spine is very complex. Take a model of the spine and we look at how the spine moves. When we flex or extend our back, we have our disc that moves in the front, and then we have the joints in the back. So for one level, let's say this is 4 or 5, the problems that could cause pain could be the disc, or it could be the facets in the back. If a patient has a purely worn out bad disc, then disc replacement it can be an option. If they have facet-mediated pain or arthritis in their joints, replacing the disc is still going to make those joints move. They're arthritic and cause pain and really won't solve their pain.
So the disc is in the front, and then it's kind of like a tricycle. So the disc is in the front, and then there's those facet joints in the back. So if your wheels are bad in the back, for example, you can't just replace the front wheels. So you can't do an artificial disc if you have arthritis in the back.